Hey, welcome to my student nursing channel. And my name's Autumn, and I just wanted to share with you a couple of things. I'm taking pharmacology this summer, and my mom is also a nurse, and I want to show you what she got me. The pill book. It is the best book you could get, and it's in layman's terms. And there's more than 18.5 million copies in print. And it's the new and revised 15th edition. And it's already been amazing for me. I am so glad she got me this. It just came in the mail the other day. And also, that's not all, Manual of IV Therapeutics. Yes. And it's evidence-based practice, which of course we're huge about that in nursing. And I'm going to be using both of these to help get through pharmacology. And you know, everything going on with the stay-at-home order and safer staying at home with COVID-19 going on, having access to good resources from home is really essential. And I'm going to try to continue to add content to my YouTube channel. And I'm also going to show you how to look up a drug by the end of this video using the pill book. It is pretty cool. And I'm just so excited I get to share this with you guys. Okay, so back to the book. Let's see. Let's look up Celexa, okay? And it looks like this in the book, right here. Yeah, there you go. Okay, so it's Celexa 20 milligrams, page 1045. Let's see. Okay. All right, so it's the type of drug is selective serotonin reuptake inhibitors. So they're SSRI'S. And let's see, so generic ingredients, citalopram, hydrobromide, Celexa. Okay, so generally prescribed for depression, bulimic binge eating and vomiting. Wow. Obsessive compulsive disorder, social anxiety disorder, generalized anxiety disorder, panic disorder, migraine, diabetic peripheral neuropathy. Wow. Hot flashes, post-traumatic stress disorder, premenstrual dysphoric disorder, Raynaud's syndrome, and borderline personality disorder. Also prescribed for alcoholism, anorexia, kleptomania, irritable bowel syndrome, dyskinetic side effects of levodopa and carbidopa, and Tourette syndrome. Fluoxetine is approved for treating major depressive disorder and OCD in children. Fluvoxamine is also approved for treating OCD in children. Other SSRIs are not approved for use in children for any indication. Wow. Isn't that just interesting? Like, I wouldn't have known that yet. I still have to order my actual pharm textbook, but this is pretty cool just to get you into the meat of it all. And this is like a layman's person's terms. So it's really, it puts it in understandable phrases and sentences and really good structure grammatically too. So some general information. SSRIs are chemically unrelated to other antidepressant drugs, prevent the movement of the neurotransmitter serotonin into nerve endings. This forces serotonin to remain in the spaces surrounding nerve endings, increasing its action. Abnormal serotonin function may be involved in depression, and the SSRIs are effective in treating the common symptoms of depression. For example, they can help improve mood and mental alertness, alleviate anxiety, and improve sleep patterns. That's really interesting. I could probably use that. Improved sleep patterns, right? Us nursing students don't get enough sleep. Probably not even as nurses, I hear. So some cautions. Do not take SSRIs if you are allergic or sensitive to any of their ingredients. Some people have experienced serious drug reactions to SSRIs. SSRIs can increase the risk of suicidal thinking and behavior. The risk of suicide is higher in teens and adults up to age 24, about the same in people aged 25 to 64, and reduced in people aged 65 and over. Young people who have started on an antidepressant should be observed closely for clinical worsening of depression, suicidality, or unusual changes in behavior, especially at the beginning of therapy or when the dose is increased or decreased. Suicide risk is especially high in severely depressed people and may continue until the condition is significantly improved. Severely depressed people should be allowed to carry only small quantities of SSRIs to limit the risk of overdose. Serious, potentially fatal reactions may occur if SSRIs and monoamine oxidase inhibitor, MAOI, antidepressant are taken within 2 weeks of one another. See drug interactions. About 7% of people taking fluoxetine develop an itching rash, and a third of them of whom have to stop taking this medication. Underweight, depressed people who take fluoxetine may lose more weight. About 9% of people taking fluoxetine experience appetite loss, and 13% lose more than 5% of their body weight. Wow, that is really not healthy. That is not good. They also affect blood platelets, although their exact effect is not known. Some people have had the abnormal bleeding while taking these drugs, especially if they're taking other drugs that affect blood clotting functions. SSRIs are significantly broken down in the liver. People with liver disease should use these drugs with caution and may require lower doses than people without liver disease. Well, that makes sense, because if their liver is not functioning and it's going into failure, it's not going to be able to metabolize much medication. So that does make sense to me. People with severe kidney disease should begin with smaller doses of citalopram, paratoxine, and sertraline. People taking SSRIs may experience a severe drop in their blood sodium level, especially if taking diuretics as well. Sodium levels usually return to normal when the medicine is stopped, but medical treatment is often necessary. SSRIs should be used with caution when people with seizure disorders and by people with glaucoma. Wow. People with mania or hypomania may experience an activation or worsening of their condition when taking SSRIs, especially if they are not also taking an anti-manic medication. Fluoxetine may alter blood sugar control in people with diabetes. SSRIs should be discontinued gradually, as significant side effects from discontinuing too quickly may occur. Rarely, people taking SSRIs develop a group of symptoms called serotonin syndrome, consisting of one or more of the following symptoms: excitement, a mild manic reaction, restlessness, loss of consciousness, confusion, disorientation, anxiety, agitation, muscle weakness, muscle spasms, tremors, involuntary muscle movements on one side of the body, shivering and dilated pupils, sweating, vomiting, and rapid heartbeat. Serotonin syndrome requires immediate medical treatment. Babies born of mothers who took an SSRI may develop a rare heartbeat and lung condition known as PPHN, persistent pulmonary hypertension of the newborn. Wow, that is terrible. It says that PPHN occurs when a newborn baby cannot properly adapt to breathing on his or her own outside of the mother's womb. Newborns with PPHN may need intensive care to increase their blood oxygen levels. Severe PPHN can damage multiple organs, including the brain, and even cause death. So don't let your patients, if they're pregnant or about to be giving birth, don't let them be having SSRIs, because it's going to hurt their baby. And it goes into different side effects and drug interactions. It's a really great book, guys. It's a wonderful resource. And I'm so glad I have something like this to get me through pharmacology. And it goes into food interactions. They can be taken with or without food. That's good. And then it goes into usual doses. All right. Overdose, special precautions, special populations. Yes, and it goes right into pregnancy and breastfeeding. Very important. Yeah, they don't really want to be on that. That's what that sounds like. So, well, thank you for listening to me read from the pill book, and you learned a little bit more about that drug. So I'm going to get better at making these videos, and well, today is my first day of summer school, so I've been enjoying some time at home while my boyfriend is at work, and you know, I'm just so excited to be here and so excited to be in the program. And I hope you enjoyed the video, and stay tuned for more videos. I will be going into how to study best for pharmacology and what techniques I use to study. Have a good one. Bye.